guys.
Oh,
Annie, where are you? That's the one.
Thanks for coming over, everybody. We'll wait for you.
Morning, so you starting right now? Are you already doing it?
We are starting, yeah.
Are we rolling?
Are we waiting for anybody?
We're not waiting for anybody, I guess. I'm, yeah, just want to remind everybody about this.
Yes.
This is Danny's notebook. He wrote his reflection, sorry, Danny. Wrote his reflection while Evelina was giving her speech. It's great. It's a full paragraph. He's done with that one. And now he can continue with the next one. That's what I'm really strongly encouraging that you do.
Nice.
Okay, for the LOL.
Okay.
Thank you, sorry.
Thank you. Well, we have our second senior speech, our presentation. Nat has done a ton of work, a lot of research, dove into a project that they are extremely passionate about. I think it's something that, you know, all of you will relate to, even if you don't have a cat or aren't interested. It's still something that's really fascinating, and hopefully you all learn something new. So thank you for giving up your attention and learning about linology.
Thank you, Ms. Fornes. So, who here has had a cat? As you have probably heard, sorry, it's bothering me a little bit. As you have probably heard, I have had a cat for 5 years now, after a life of cat obsession quite literally from birth. My mom can speak about how often I asked for a cat. I spent so much of my time with access to the internet and the library that I would constantly research all about cats and their care. This led to a very easy choice for my senior project. My cat Bug is about 8 years old, and he is FIV or feline immunodeficiency virus positive. And when I got him, he had an upper respiratory infection that was rotting his teeth. He also had fleas, and if you've ever had to deal with a cat with fleas that you had to bathe, you know it is a battle. Felines are complex creatures. Knowledge of their evolutionary history, their environmental impact, and behavioral knowledge will help you best care for and understand domestic cats. Cats are known for their independent and often secretive nature. Their ability to hide problems is impressive and can make cat owners' lives hard. Unlike dogs, who might show more obvious signs of distress, cats tend to hide their discomfort until their condition becomes deadly. Being educated on their subtle signs is one of the most important things when owning a cat, along with having money saved to make emergency vet appointments and annual appointments less stressful. This can help ensure that a cat receives treatment before an illness becomes life-threatening. Felines are complex animals, and understanding their evolution, impact on the environment, and behavior is key to providing the best care for cats. My research topics for this project were evolutionary history, domestication, environmental impact, behavioral psychology, veterinary medicine, and cat care. Cats were domesticated 10,000 years ago in the Middle East. Evidence of this is found in Egyptian tombs where they were left and buried beside their owners. Around 3000 BC, people in China started to domesticate the leopard cat and the western cat to control pests. These domesticated cats became beloved pets, depicted in paintings and sculptures during the Sung Dynasty. In the 16th century, cats were brought to North and South America by European settlers to help control rodents. Cats are often considered semi-domesticated rather than fully domesticated like dogs. Unlike other animals that were selectively bred for traits over many years, cats largely domesticated themselves by developing a mutually beneficial relationship with humans. One reason cats can be considered domesticated is their adaptation to human life. They live comfortably with humans, depend on them for food, and display social behaviors like rubbing against us or following us around. Did you know that an indoor cat has a life expectancy of 15 to 17 years or more, while the life expectancy for outdoor cats is only 2 to 5 years, according to researchers at University of California, Davis. Cats behave the way they do because of their evolutionary history as solitary hunters. Their ancestors, the African wildcat, developed specific behaviors to help them survive in the wild. These behaviors are called instinctual behaviors. Though domestic cats have lived with humans for thousands of years, they have retained these specific skills. Two of cats' most important skills are hunting and playing. They often stalk, pounce, and play with their prey before delivering a killing bite to the neck. Even well-fed house cats will chase and bat at objects in a similar way. This is because, as obligate carnivores, cats evolved to be stealthy and precise hunters that rely on quick and accurate attacks rather than endurance or pack hunting. Play behavior is used to keep these skills, which are important for survival in the wild. Another instinctual behavior is territorial marking. Cats rub their faces on people and furniture, scratch surfaces, and spray urine to mark their territory. In the wild, cats are solitary creatures, and marking their territory helps prevent conflict by showing ownership. Cats have scent glands in their cheeks, lips, ears, paws, urinary tract, anus, and the base of their tails that communicate important information to other cats, such as where their boundaries are or if they are available for mating. Cats are also known for being nocturnal and crepuscular, meaning they are most active during dawn and dusk. This is why some cats will get zoomies late at night or very early in the morning, especially if they are indoors. This behavior stems from their wild ancestors, who hunted small rodents that were most active during those hours. Being active at twilight also allowed them to hunt without the risk of larger predators who were active during the day and night. Another behavior is kneading and purring. Cats often knead soft surfaces with their paws and purr when they are content or seeking comfort. Kittens knead their mother's bellies to stimulate milk flow, and this behavior continues into adulthood as a sign of comfort and bonding. Purring most likely developed as a way for kittens to communicate with their mothers, but adult cats also purr to self-soothe and bond socially. Some studies might even suggest that purring has healing properties. One of cats' most notable behaviors is their constant grooming, spending hours licking themselves to stay clean and grooming other cats or their human companions. In the wild, this behavior helps get rid of scent that could attract predators or alert prey. Aloe grooming is an important part of social interactions in groups of cats. It helps strengthen bonds and reduce stress, making them feel comfortable and secure. Cats often will enjoy hiding in small spaces such as boxes or under furniture, along with hide-up places like shelves and dressers. This behavior has a place in their evolutionary past. Cats' ancestors would seek out small enclosed spaces to hide from predators. Being in these tight spaces helps make them feel safe. High-up spaces would help give them a better sense of their surroundings, allowing them to spot predators or prey. Now, domestic cats still have this instinct to hide in small spaces and sleep in elevated places to bring comfort and safety. A common behavior you might see often in domestic cats is slow blinking and headbutting, which are signs of affection. When a cat slowly blinks at you, it shows trust and relaxation because direct eye contact in the wild can be seen as a threat. By slowly blinking, a cat communicates that it feels safe and secure. Similarly, when a cat headbutts you or other objects, they are marking them with their scent, showing that they are a part of the cat's safe environment. Both of these behaviors are examples of love and affection towards those who they trust. Cats are prone to having behavioral issues that are frustrating for their owners. Understanding these behaviors and their causes is important to finding solutions that will help both the cat and the owner maintain a happy and healthy relationship. One common issue is a cat refusing to use their litter box. Medical issues such as urinary tract infections kidney disease, or digestive issues are common culprits. If a cat is experiencing pain or discomfort, even in places like the joints, it might avoid the litter box. Another cause is a dirty litter box, as cats are very clean animals and will avoid the box if not kept clean. This is why it is recommended to clean your litter boxes at least once a day. Some cats also have a preference for the type of litter used. Things like scented litter or litter that is not soft can discourage them from using the litter box. Stress or anxiety caused by territorial disputes or changes in the household can also lead to litter box issues. The placement of the litter box is also very important. If it is placed in a high traffic area or too close to their food, the cat may refuse to use it entirely. To solve this problem, rule out any medical issues with your vet, keep the litter box clean, and place the box in a quiet, accessible location. Another common issue is scratching. It could be furniture or people. Cats scratch for several different reasons, including marking their territory. They have scent glands in their paws, which allows them to leave both scent and visual representation. Scratching also helps cats shed the dead layers of their nails, promoting healthy nail growth. Boredom and excess energy can also lead to scratching, especially if there's not enough playtime. Scratching can also happen if there are no appropriate surfaces for them to scratch. Aggression in cats directed towards cats and other animals can be shown through biting, hissing, swatting, or full-on attacks. Several causes can lead to this behavior, and sometimes cats will act this way out of fear, especially if they feel cornered or threatened. Other times this can be territorial aggression, especially when there are new people or pets in the home. Cats can also display redirected aggression when they see an animal outside and lash out at a human or other pet nearby. Overstimulation is another common trigger, as some cats get overwhelmed and irritated if you pet them for too long. Pain and medical issues such as dental disease, arthritis, and infections can cause aggression too, so introduce new pets slowly, respect your cat's boundaries, and take them to the vet if aggression suddenly occurs. Excessive meowing or yowling, especially at night, is a common behavior. Usually this indicates a hunger or desire for attention. Some cats might meow excessively due to stress or anxiety due to a change in routine or loneliness. Cats who are not spayed or neutered are also known to be vocal due to mating behaviors. Some older cats can also struggle with disorientation or confusion because of cognitive decline, and that can lead to meowing or yowling. Illness is also a cause, as meowing or yowling can be their only way to communicate a bigger issue, such as hyperthyroidism or kidney disease, and the pain that they cause. To solve this issue, it's important to provide basic needs of food and attention, provide enrichment opportunities, spay or neuter your cat to avoid mating behaviors, and if it is suddenly occurring, speak to your vet. Cats that hide an excessive amount can be avoiding social interactions and spend most of their time under furniture. This can be because of fear or stress caused by a new environment. Exposure to loud noises or new people being present. Illness and pain can also be the cause of this behavior because they might feel vulnerable or unwell. If this is caused suddenly, talk with your vet. If not, try letting your cat adapt on their own, especially if they were recently brought into the space that they are living in now. Create a comfortable environment with places specifically for them to sleep, like cat beds and hides, and monitor for other odd behaviors. As I stated earlier, cats groom themselves a lot, but over-grooming and fur pulling are common but harmful behaviors, and it can lead to hair loss and open wounds. This can happen when a cat licks, bites, or pulls at their fur, and there are several reasons why this can occur. Some causes are allergies or skin irritation, which can be from their food or environment. Fleas and parasites can also lead to over-grooming, which is why it is important to catch these things early before they can seriously affect their skin. Cats also self-soothe through grooming, so stress or anxiety can lead to over-grooming, along with over-grooming existing wounds. To solve these issues, it is important to rule out any medical conditions, and once that is addressed, try to reduce their stress levels and monitor for parasites or fleas can solve the problem. Nighttime hyperactivity, popularly nicknamed zoomies, is when cats run wildly around their home, knocking things over and pouncing on sleeping humans. This can be caused because cats are crepuscular, meaning they are more active during dawn and dusk. If the cat is hyperactive at night, it can also be caused by hunger. This can be solved by feeding them part of their daily food before bed, having satisfactory playtime during the day and before bed, and having enriching items such as toys and cat towers for them out and about their living space. A very common unpleasant behavior is knocking things over, pushing things off counters and tables and shelves, seemingly on purpose. This behavior is linked back to their hunting instinct. They will test what will happen like how they test prey in the wild. It can also be caused if they do not get enough attention. They will seek a reaction from their owner. Curiosity is also a big part. Cats are curious creatures and they like to explore their environments. To resolve this issue, make sure your cat has plenty of playtime with you and secure valuables that are at risk of being knocked over. A lot of people recommend museum wax if you struggle with that. Cats show a mixture of behaviors that can be broadly categorized into two types: instinctual and learned. Instinctual behaviors are deeply rooted in their evolutionary history. Learned behaviors are a result of socialization and experiences. Understanding the difference between these two can help cat owners navigate the challenges of training and managing their pets. Instinctual behaviors are actions that cats display due to their evolutionary instincts, and these are close to impossible to change, especially without harming the cat. One of the most obvious examples of instinctive behavior is the cat's hunting instinct. Even a well-fed cat will still stalk, pounce, and play with toys or prey. This behavior is a part of their survival skills that are deeply embedded in their DNA. Even domestic cats who no longer need to hunt for food retain these hunting tendencies. These behaviors often manifest during playtime. Territorial marking is another instinctual behavior. Cats use scratching, rubbing, and sometimes spraying to claim their space. This behavior is natural and essential for marking territory, which helps them avoid conflict with other animals and establish boundaries. These actions are often difficult to control through training, especially when cats feel threatened or anxious. The reversion to water is another deeply ingrained instinct in cats. Most cats avoid water because their fur, when wet, reduces their ability to regulate their body temperature. While some cats might tolerate water, most will resist it, making it one of the hardest behaviors to change and a struggle to bathe them. There are behaviors that cats learn over time through their environment and experiences. These learned behaviors can be shaped through training and consistency. For instance, using a litter box is a behavior that cats easily learn because they have a natural instinct to bury their waste. By providing a clean, accessible litter box, owners can train their cats to use it consistently. Cats can also learn some words like their names or commands like come, yes, no, or no through positive reinforcement. Early socialization is crucial for having cats tolerate handling for grooming, like cutting their nails, or even just being picked up by people. And the lack of it in strays can lead to them becoming very intolerant of humans. Some cats can be trained to walk on a leash with a harness to be able to enjoy the outdoors safely for both the cats and the local wildlife. Tricks like sitting on command, jumping hoops, or shaking hands can be taught with lots of patience and treats. Positive reinforcement, consistency and patience, and respecting their choices in these methods, because forcing behaviors doesn't work, are what works best. What does not work is punishment or yelling, which causes fear instead of learning, and expecting behavior similar to a dog who wants to please you, and training against their instincts, like how you can redirect scratching but not completely stop it. Be vigilant of cats' behavior to be able to notice when something is going on. Vigilance can also pay off in identifying illness or injury because, Identifying injury or illness in cats can be difficult because they tend to hide them very well. Because of this, it is important to be vigilant of when your cat's behavior changes and feel their bodies gently when you pet them to find any abnormalities. Cats that are overweight are 4 times more likely to develop diabetes compared to cats that maintain a healthy weight. Cancer in cats can cause a lot of symptoms, which largely depends on what kind of cancer it is, but many warning signs are consistent throughout. One of the most notable symptoms is lumps or bumps spotted or felt on your cat's body that might change in size or shape over time. Cats who are developing cancer will also experience lethargy, along with vomiting or difficulty eating. Gastrointestinal issues such as diarrhea and trouble passing urine or feces can also be signs of cancer, along with labored breathing or struggling to breathe. Sores that won't heal, bloating, blood in the feces or urine are all signs of cancer as well, and should be a prompt visit to the vet. Did you know that pet owners should set aside at least $2,500 to $8,000 if they do not have pet insurance as an emergency fund? And a multi-pet household should aim for the higher range. Several things contribute to the development of cancer in cats, such as exposures to toxins like cigarette smoke or asbestos. UV light, feline leukemia virus, and feline immunodeficiency virus have also been linked to certain kinds of cancer. Injections, vaccinations, healed fractures, and implanted medical devices also play a role in increasing the risk of cancer. But that is not to say that these important medical procedures should not be done. The age when a cat gets spayed or neutered, along with breed, can also play a role in increasing risk. Older cats are also more likely to develop cancer, but the type of it varies by age. Feline immunodeficiency virus, as I mentioned earlier, is a significant and common disease affecting cats worldwide, and it weakens the cat's immune system, making them more vulnerable to infection. Cats infected with FIV cannot show symptoms for many years, but eventually their immune system will become compromised, leaving them vulnerable to severe illnesses caused by normally harmless bacteria, viruses, and fungi. While there is no cure for FIV, a lot of infected cats live normal and healthy lives for many years, especially if they do not also suffer from feline leukemia virus. FIV is mostly spread through bite wounds from infected cats, and unlike some diseases, casual contact such as mutual grooming or sharing water bowls does not spread FIV. The risk of infection is higher among unneutered male cats with access to the outdoors, especially ones who commonly get in fights. Kittens can sometimes be born with FIV if their mother was infected, but it is not common. Unlike HIV, sexual contact does not significantly contribute to the spread of FIV. Around 2.5 to 5% of healthy cats in North America are infected with FIV, though rates are higher by around 15% or more among sick or high-risk cats. Preventing exposure is the best way to reduce the spread of the virus, and the best method is to keep cats indoors and to have all household cats tested regularly, though there is no vaccine for FIV available in North America. The FIV infection progresses through 3 stages: the acute phase, the asymptomatic phase, and the progressive phase. The acute phase occurs 1 to 3 months after infection, when the virus spreads to the cat's lymph nodes. This stage is often mild with symptoms like fever, depression, and loss of appetite. The asymptomatic phase can last from months to years, during which the virus replicates slowly and most cats show no symptoms. The blood test may reveal how low their white blood cell counts are. Eventually, cats enter the progressive phase, where their immune system weakens, leading to frequent secondary infections, such as skin, eye, urinary tract, and respiratory infections. FIV can cause serious health problems in cats, like severe gum disease. Other issues include weight loss, seizures, and brain problems. When a cat faces multiple serious illnesses, its chances of survival decrease, often only living for a few more months. FIV is usually diagnosed with a blood test that looks for antibodies to the virus. One common test is the ELISA, which is a mouthful, and which vets can perform in their office. However, since it can take 2 to 6 months for antibodies to show up after infection, a negative result might not rule out the disease if the cat was recently exposed. Cats with FIV can live long, healthy lives if managed properly. The key is to prevent other infections and stop the virus from spreading to other cats. FIV-positive cats should stay indoors, avoid contact with other cats, and be neutered to prevent fighting. A balanced diet, regular vet visits, and close monitoring for any signs of illness are also important for maintaining the health of an FIV-positive cat. When secondary infections do happen in FIV-positive cats, they need to be treated immediately with antibiotics or other medications. Antiviral treatments have been used to manage symptoms like dental inflammation, but don't significantly improve the cat's lifespan. The best way to prevent FIV is to avoid exposure to infected cats. This is why it is important to test new cats for FIV before introducing them to your household. While there is no vaccination for FIV in North America, a vaccination is available in Japan and Australia, and I'm hoping it'll come here soon. Even though FIV is similar to HIV because it affects the immune system, it is a species-specific virus that cannot be transferred to humans. Feline leukemia virus, or FELV, is similar to FIV in that it is common and widespread in cats. 2 to 3% of cats in North America are infected with FELV, and the rate is even higher in cats that are already ill or in high-risk environments. Over the past 25 years, the development of vaccines and improved diagnostic tests have reduced the prevalence of this disease, but it continues to be an important concern for both pet owners and vets. FELV is a type of retrovirus, which means it can become part of the cat's DNA and stay with them for life. And infected cats can spread the virus through their saliva, feces, urine, and milk. Close contact between cats, like biting, grooming, or sharing food in litter boxes, is the most common way the virus is transmitted, and mother cats can also pass the virus to their kittens during pregnancy or while nursing. Arthritis or osteoarthritis is one of the most common chronic conditions in older cats, which causes painful inflammation in the joints that limits activity and movement. Symptoms of arthritis in cats are limping or having a hard time walking, resistance to jumping or climbing, lack of grooming, behavioral changes such as aggression or hiding, lethargy, and loss of muscle mass due to less movement. Chronic kidney disease often occurs in older cats and can cause symptoms like excessive thirst, weight loss, and vomiting. Regular checkups, increased water intake, which is why a fountain is recommended, and a special diet from your veterinarian can help to manage CKD. Hyperthyroidism is caused by an overactive thyroid, and it leads to symptoms like weight loss, increased appetite, restlessness, and poor coat condition. Medication or surgery might be required to manage the cat's thyroid levels. When you find out your cat is struggling with a chronic illness, it is important to know how to accommodate them. Providing easy access to their food, water, and litter box reduces the effort required for your cat to move around, and is one of the most important things you can do for them. Soft bedding in warm and quiet areas can help arthritic cats avoid cold, hard floors that can worsen their joint pain. Ramps or steps up to your bed or other furniture can help your cats reach high places easily if jumping is difficult. Consulting your veterinarian about pain relief, such as medications, can help manage arthritis and other chronic illnesses. Gentle massage and stretching as shown by your vet can help improve mobility. Supplements, such as omega-3 fatty acids, can help to support joint health too. Encouraging movement and play is crucial to keeping your cat healthy even when they have chronic illnesses. Interactive toys that stimulate light activity without overexerting your cat can help maintain joint mobility and prevent muscle loss. You can gradually increase the amount of playtime if your cat is willing with more frequent, short sessions. Monitoring diet and weight is important to track your cat's health. Maintaining a healthy weight is crucial for all cats, but with arthritis, the extra weight puts stress on the joints. Choosing healthy, age-appropriate, and high-quality food provides the necessary nutrients for managing issues such as kidney disease and diabetes. Frequent vet checkups are important for monitoring the progression of your cat's chronic illness. Your vet will work long-term through different treatment options and adjust medications if needed. If your cat has arthritis or other long-term chronic illnesses, blood work, urine tests, and imaging can be necessary for monitoring changes in their health. Hydrating your cat can be extremely important for a cat with CKD or diabetes, and a cat water fountain can encourage water consumption, along with feeding wet food. Cats with chronic illnesses can experience high levels of stress and anxiety because of their pain. Pheromone diffusers or spray are commonly used in veterinary offices and can be calming and help them feel more secure. Being patient and gentle with your cat through these hard times can make all the difference, especially if they withdraw because of pain. Supporting your cats is also important when deciding their time outside, because domestic cats are an invasive species. They heavily affect the environment around them. They have caused the extinction of 63 species of birds, mammals, and reptiles, and continue to harm many others, including endangered species like the piping plover, according to abcbirds.org. In the U.S., outdoor cats kill an estimated 2.4 billion birds annually. To prevent this, trap, neuter, release, or TNR, is a method used to manage feral cat populations. And it has become more common in recent years. If you've seen a stray cat with a clipped ear, it's probably part of a TNR program. Another reason why it's important to control cat populations is because their feces can carry a parasite that is harmful to humans and wildlife. Improper disposal can contaminate water and soil and has severely affected animals like the Hawaiian monk seals that do not interact with cats directly. In conclusion, felines are complex creatures. When addressing cat behaviors, knowledge of which behaviors are caused by their environment versus which behaviors are instinctive will help the owner know what behaviors can be changed by changing the environment, and what behaviors are natural and cannot be changed. Another consideration when addressing cat behaviors is the overall health of the cat, ensuring the cat is healthy physically and psychologically. An odd behavior that I found was interesting was when a cat is in a plantigrade stance or walking on their lower leg. This is a sign that the cat has severe untreated diabetes. Knowing this and other signs is like learning how to speak another language and to understand if a cat is in pain or has something seriously wrong. Taking the time to learn this language can help to become the best cat owner possible. So my products, I made a few different things, and I'm super happy with all of my things. I said things. I made a felted cat dissection. As seen here. And on the back it is open, and I have all the felted organs. And then I also made a booklet to go along with it, with information. Oh, it was upside down. With information about the organs inside to go with the cat. I also created a survey that I shared during Monday morning meeting last week, but I regret that I waited so long to share it because I only got 2 responses. Thank you, Ms. Varnes. And so I wasn't able to get good information from it. I also created a website. Which I will use in the future to help with my cat sanctuary. I have spots for the information that I learned throughout this project. And then more information about my project and information about my cat sanctuary, which I have drawn out plans for, very unofficially, but it was really fun. Especially sitting next to Isaac all day when he's drawing all his buildings. I also created a 27-page long essay, I think. Having a long essay was definitely not in my standard project process, but I feel like it really benefited all the information that I learned and being able to get that all out somewhere, because I do only have like 50 minutes for this, was really beneficial, and I am super happy with it. I think that's it. I'd like to say thank you to my mom and my best friend and her little sister who have been with me through it all. Isaac, for helping me stay sane at school, along with my other friends, and everyone else who's helped me along the way, and my cat. I love my cat. I will now take questions. Cole?
Why don't we sell FIV vaccinations in North America anymore?
I don't believe, that's a really great question. Cole asked why we don't sell FIV vaccinations in America anymore. I don't know if we ever did. My educated guess is probably that it's just starting to be developed, and so they probably have better resources to be able to look into it, and that's why it's not here yet.
Because I looked it up, and I mean, not sure if it's accurate, but said that at one point in time it was sold in Canada and North America, but was stopped being sold for whatever reason.
Yeah, I'm sorry, I do not know the details of that, but it's definitely interesting seeing that we don't have it here, and I would love to see the development of it further here, because FIV obviously can be managed, but it is also fairly scary sometimes having a cat that if he gets sick, he could be seriously hurt. So preventing that would be awesome.
Yeah, especially if that vaccine exists, why not just sell it here?
Mm-hmm. Avery?
What happens if your cat won't stop?
Well, as I stated before, oh, sorry. Avery asked what they should do if a cat doesn't stop meowing. As I stated earlier in my presentation, their meowing can be caused by a lot of things, but it can also just be that they're social. Like my cat, in the mornings, he will follow me around as I get ready and just scream at me, it's just like how maybe you talk to your mom in the car right there or whatever. Sometimes they're just social and they just like to talk, but monitoring for other behaviors is important to make sure that it's nothing more than that. Does that answer your question? Isaac.
Favorite cat moment. Just
Isaac asked, what is my favorite cat moment? I'm gonna answer this with my cat. Probably right after he got surgery to have all his teeth removed, well, the teeth that were remaining, and he was on a wet food diet to help his gums heal properly, and he hated it. He hated every second of it. And one day, my mom found that he had ripped open the bag of dry food from before he had surgery and started eating that instead. And also the time when we had just got him, so he was being isolated in our bathroom, and we would let him down into the basement because there's no soft surfaces, so we could easily clean up after the fleas and stuff. And apparently my mom felt intimidated by him, and he refused to go back in the bathroom from that day. Hazel?
Do you have any plans for education after high school?
Hazel asks if I have any plans for education after high school. I personally do not, which is honestly a weird situation, seeing as like all my friends are going to secondary education. Is that what it's called? But honestly, I do not have any plans for college. I might go and get something to be like, I might go to get education for a veterinary technician, just to have that like training. So when I own my cat sanctuary, I'll be able to do that sort of stuff, but it is not in my direct future.
What was your favorite and least favorite part of the project?
Abby asks, what is my favorite and least favorite part of this project? I would say my least favorite was, oh, that's hard because I liked a lot of it. Honestly, probably working up to this presentation and doing it, I'm really nervous. And I know that's normal and it's okay, and I did it anyway, but wow, it has been stressful. And then my favorite part has probably been either being able to share my information with all of you, because I like to educate, or my cat dissection, because it's so cute. I love felting, it was so fun. Isaac?
advice for future seniors.
Isaac asks, advice for future seniors. This is kind of lame, but sorry, I just got really close to the mic. Choose a topic you're really passionate about or have already looked into already, because obviously you have to do preliminary research, but having like some sort of background interest in your senior project is so important, because if I did this project on anything else, I don't think I could have actually finished it, because it is just such a big project that if you're not passionate through all of it, then it makes it like super hard to get 300 hours. Emily?
Do you know what breed your cat is?
Emily asks, do I know what breed my cat is? I do not, because he was a stray found outside my grandma's house in the forest. So he's a short hair, he has tabby markings, but I know nothing other than that. Miss Fornes?
Can you explain some cat enrichment activities? And then the second part of that question is like, how do you prevent like scratching, things like that? Like, is water a thing that you can do to encourage stop with those inappropriate activities?
Okay, I'm gonna try to answer that all in one go, but if I have to ask you the second part again, sorry. Ms. Farnes asks, the first part is, what are enrichment opportunities for your cat that you can do at home? I have both a cat like plastic puzzle that they like mess around with and get treats out of, and then I also made a like little foraging mat. It's basically a piece of fabric with a bunch of rows of more fabric snipped into little like tassels almost, and then you like bury the treats in there, and then they dig them out and find them. I also chase my cat around the house. He likes that, so I play with him like I'm another cat. I think that's beneficial for him to have a playmate, so that is how I do that. And then, remind me of your second question?
How do you prevent scratching
People or surfaces?
surfaces?
So Ms. Fornes asks how you can prevent scratching. Honestly, the best way is providing obviously like enough surfaces that they're supposed to scratch, and then like catnip or like a catnip spray can, if you put that on there, it can help encourage them to go on that instead of your furniture and stuff. And I think you asked like
You like spray them with water?
spraying them with water is not the greatest because it leads into the like fear rather than learning. So they'll just learn to do that when you're not around. And can also lead to your cat being scared of you. Tegan?
Do you plan to start your cat sanctuary right out of high school? Like, do you have a timeline?
Tegan asks if I have plans to open my cat sanctuary right away after high school and what my timeline is. I plan on waiting a bit because obviously I have to start making money for it to fund the building and stuff. So I envision like at least like the hot seat question this morning. In 5 years, I will probably have that sanctuary. I'd really like to have that sanctuary by then. Because I'd like to do the most of my time on this earth as I can. So I'd like to get that done as soon as possible, but I know that is like a big task right out of high school. But I will begin spreading my message, funding, and educating, I guess, until then. And does that answer your question good? Okay. Avery?
What's your favorite breed of cat?
Avery asks what my favorite breed of cat is. And I love my cat the most, but my favorite breed is probably calico cats. My grandma's cat that she had when I was a little baby, name is Callie, very original, was a calico cat, and I have just loved them since then. They are so pretty. Cameron?
Least favorite cat breed. Whoa.
Cameron asks least favorite cat breed. I would say Scottish Folds. They are so cute, but they end up with a lot of ear issues because their ears droop over the ear opening. So it can lead to a lot of issues. That's only the reason that I don't like any breeds of cats is because they're bred unethically and have health issues because of it. I like all the cats though. I like hairless cats. They're very cute. Moving on. Miss Vicky?
Did you mention life sources?
Oh, I did not mention life sources. Miss Vicky asks if I mentioned life sources. I reached out to a lot of people because I wanted a lot of live sources for this project, but I did not get that many responses. I talked to Angela Braun at Country View Animal Hospital, Becky Sapola, Evelina's mom. Thank you, Evelina. And I can't remember her name. She owns a farm sanctuary. I had it in my speech and I don't know where it went. But I super appreciate all those people. They gave me some really great information, especially Angela, because I shadowed her and then shadowed at a different location, different vet, but in the same company. And getting to like see a cat dental cleaning and just like general appointments was really cool. Miss K.
What part of the project process do you think has grown the most over time, or have you purposefully grown the most over time?
I feel like, Miss K asked what in my project process has grown the most over time. I would say my writing. Coming out of middle school and into high school, I had written like 2 papers at my old school, and they were not very good. One of them was a story. I don't know how many research papers I did. I didn't have a lot of writing experience, and I was able, obviously I'm not the greatest, but I definitely say if I can write a 27-page long essay, I'm pretty decent. I've learned a lot throughout my essays, and I think that's been really beneficial because now I have the knowledge. Cameron, again.
Yeah, do you like Fingus or Floppa more? You asked me, Cooper, I'm doing this, because you have the nerve to do it.
Okay, I'll answer, I guess. Cameron asks, do I
On the wall over there.
like Bingus or Floppa more? I like Bingus.
Get out of my face. Get off the stage, please.
Be kind, Cameron. Malia.
Thoughts on dogs?
Malia asks my thoughts on dogs. I think they are so cute. I like them. I personally could not own one. I get really overwhelmed really easily, and they are very in your face sometimes, and I don't want to pick up their poop. Not really my thing. But they're very cute, and I like other people's dogs. But also, like when you pet a dog, it leaves like an oily residue on your hands. Cats don't do that unless they're like really old. I don't like it. Isaac?
So if you could redo your project or year, what's something you would do differently?
Isaac asks if I could redo anything in my senior project or year, what would I do differently? I don't know what I would do differently. I kind of had a great time most of it. I would have liked to be able to start my senior project a little earlier, but getting out with like all the logistics, it was kind of hard to get it started at first. Along with not getting very many vice responses at first, kind of set me back a little bit. But honestly, there's nothing super big that I would change. Kira? Kira asks, do I want another cat? Yes, I want lots of cats. Lots of cats in my house. Is that it now? Miss K?
You mentioned cats being a cause of extinction of other species. I wonder if you could tell us a little bit more about that problem. Is it just in the US? Is it other places? Is it just because of feral cats, or is it because of people letting their house cats out? Expand.
Miss K asks me to elaborate on the extinction of animals caused by cats. So it does happen everywhere in the US because they are not native to here. They're invasive, and partially that can be to blame because they reproduce so fast, and also it is also caused by people letting their cats outside. They're not natural predators for the environments that they are put into, and so the animals there are not set to like accommodate for that. Does that answer your question?
So,
Corbin?
Thoughts on hunting feral cats?
Thoughts on hunting feral cats? I do not like that. I think they should be TNR'd, which is trap, neuter, release, or they should be rehomed. I personally think it's cruel to put an animal through that if it's not like necessary. I know people eat meat. I don't eat meat. I don't know. I don't know. I don't like the idea of taking the lives of things. And I think we can accommodate for that in different ways. Cole?
Would you say, a cat that's outdoors only becomes a problem when they're able to roam free? Cause, like this summer, I let my cat outside, however, he's on a leash and he's exclusively in my backyard. So, therefore, he's not a threat to any animals unless if they get into his path.
Cole asks if it is harmful to have his cat outside if it is not able to attack other things, I guess. It is totally fine to bring your cat outside in supervised conditions, such as like a catio, which is a cat patio, which is fully enclosed, and so nothing can get in, nothing can get out, so they can experience the fresh air in the outdoors without actually harming the environment. But on a leash is totally fine too. As long as you're picking up their poop and stuff, and obviously not letting them free roam, it is totally fine. And it is nice to have your cats go outside for enrichment, especially on warm, sunny days. They love the sun. Oh, Milo? Milo asks how I feel about breeders. I do not think breeders are great, just because the majority of the time they are not very ethical, along with the fact that cats reproduce so fast that we already have so many cats. We do not need any more cats. Please neuter and spay your cats. Please. We have enough cats. And a lot of times, if they're like purebred, like dogs, they're usually inbred and leads to severe issues. So I do not agree with breeders.
Hey, thank you, Ned. All right, just a reminder to write your paragraph reflection on Ned's presentation and do whatever you need to do before you head out today.